It's a great question, Steve. Steve asks about contact tracing and to what extent we've been able to trace back some of our cases to events that may have occurred elsewhere in the country and things of that nature. And Steve, the answer is we have been able to do a very robust amount of that. So much so that it's almost on a daily basis too overwhelming for these briefings to go into. But I'll first extend my thanks to our gumshoe epidemiologists. They have been the quiet heroes of this entire outbreak. Since day one, they have been out there talking to people to learn their stories, put together these really complicated timelines, and try to get a better sense of who might have infected whom. And as a result, we actually have been able to paint two very interesting pictures of the way that the outbreak in Maine has unfolded. The first is, I want to go back to, I think, what Caitlin and I talked about, which is one of the pictures that has emerged is that there's a high degree of intra-household transmission in Maine and in other states. And we've seen that repeat itself over and over again. So much so that, as I mentioned, when we get a new case, one of the first things we ask is, tell us everything about where you live, who lives with you, is there anyone elderly there, is there anyone with lung disease, because we know that the risk of transmission within households is very high, and we've seen that replicate itself. The other interesting phenomenon that we have uncovered, I want to share this in a way to make sure that we don't breach any confidentiality, but the way that our epidemiologists put this together is nothing short of astounding and awe-inspiring. Earlier on in the outbreak, we detected a cluster of cases that were linked to an individual whose job is to be a traveling salesperson. And this traveling salesperson visited a particular establishment in Maine and had a series of meetings and infected a certain number of individuals, all of whom we traced and gave advice to. But when we looked back at this particular individual's travel history, we also learned that this individual, because of the nature of their job, and notice I'm not using any gender pronouns, because of the nature of their job, had visited other similar establishments in other states. And we reached out to those states, and it turns out that this individual seems to have had a pattern of spreading COVID-19 across a number of states. And we've pieced that together. We've talked about writing that up for one of the CDC journals as an example of the work that gumshoe epidemiologists can do when contact tracing is made a priority, as we've done so here. Difficult thing for me to convey in a soundbite, Steve, so I won't go into it too much more, but suffice it to say that our team has been able to trace a fair number of the cases in Maine, if not back to sort of patient zero, but pretty far back down the line based on travel and such things. Now, when you get into a world of community transmission in Cumberland and York, that becomes very, very difficult by definition. But in areas where there's no community transmission, that's what our epidemiology team has been able to do. That was a really long answer. I hope you can make some sense of that.